Thank you, dear ladies and gentlemen.
Good afternoon, ladies and gentlemen. Allow us to please stand on the protocol observed prior to our entrance. Before you, we have a group of young leaders who come from across the African continent, and we're also joined by Pakistan in our midst today. We've come before you to not only present to you what we have done in the interim over the past 5 days, but to also share with you what it is we would like to do beyond this conference. I go by the name Mavis Elias, and I will be your co-MC. I actually have a gentleman behind me who will be helping facilitate the program for the youth leaders today.
Good afternoon, dear ladies and gentlemen. My name is Nick. I'm from Nairobi, Kenya, and maybe to share with you briefly about what we've been doing in the past week. Last week we had a lot of people arriving in Nairobi, and also we had a lot of organizations and trainers from different organizations from CADCA. They flew all the way from the United States of America to come and join us and also train us. We had around 30 people who came last week that were the assistant trainers, and we've been trained. And I know that by the time we will be going back to our countries and back in our communities, every single thing that we've learned in this training, we are going to implement them. And I know it's not just going to be a desire to see things differently, but rather it's going to be a reality of implementation in all the things that we will be doing. During this week, we went across again with new youths from different countries and also around Kenya. And we were taken through how to organize most of our planning and other things. And I thank you, dear ladies and gentlemen, for such an amazing time. And also I welcome you again back to Nairobi. Back to you, sir.
I would like to say thank you to the INL from the Department of State, Colombo Plan Drug Advisory Program, CADCA Youth Leadership who facilitated the training, and our host NACADA and ISSUP for making this possible. And more importantly, the youth who stand before you, who flew from across the African continent to ensure that they came to be helped, to ensure that they could get some skills and actually implement these. As Nick mentioned, we had a 5-day training which allowed us to actually develop programs as well as interventions that we could go and implement in our home countries. There were 30 different projects that were presented. However, we'd like to show you 2 examples of what this actually looks like. It's ultimately bringing together ideas and facilitating the process of how exactly you will implement these upon your arrival back home. We have 2 groups here for you today, and we'd like to start with a group from Seychelles who will be presenting to you their projects and what exactly they have planned upon their return back home. So please help me put your hands together and welcome the Seychelles team.
Respected guests, ladies and gentlemen, good morning. Okay, respected guests, ladies and gentlemen, a very good morning to you all. My name is Alan. My colleagues' names are Jennifer, Vivian, Saranta, and Aruna. We are all from Seychelles. The title of our project is Tackling of Heroin Use in Mofleri.
So good morning, everyone. Like my colleague mentioned, I'll be presenting our community, which is Mofleri. So here is our map. You will see that we have identified the different structures in our community. We have the church, playing field, and basketball court. So, and the clinic. As we can see, the church, the school, and the clinic, they are already working in coalition to tackle the issue of heroin in our community. But we have identified specific hotspots. As we all can see here, it's in a triangular shape. It's a housing estate, the ghetto, and the basketball court. And from there, we have used the logic model to identify our problem statement, which leads to our implementation of our strategies. So, our problem statement is youth and minors using heroin in Mofleri district. So from there, we have identified 2 risk factors, which is social access and norms and the law enforcement. However, we are focusing on only law and enforcement, which is police are aware of the hotspots in our community, but they are reluctant to intervene. So from there, we have identified 2 local conditions, which is drug dealers are selling heroin in Calgata State, and police and residents are not working together to prevent drug abuse in Calgata State. So from there, from the 2 local conditions, we're focusing on drug dealers are selling heroin in Calgata State. Now I will pass on to my colleague, which will present our strategies.
Good afternoon, esteemed guests. So the prevention strategies that we came up with were to provide information by disseminating information, education, and communication materials. So social media, leaflets, workshops, and the general media, the TV and the radio. And also, we would like to enhance the skills of the police officers that are working in the communities, and also the community leaders and the residents, to empower them also to make a change in their communities. To provide support, we would like to identify the residents and identify the people that want to be involved in this fight against drugs, and create the neighborhood watch so that they can help the police in doing their job. For more access to this, we would like to introduce an anonymous hotline that would allow these residents to report any suspecting activities that happens in that area. And also to increase drug rates and checkpoints to prevent the trafficking of drugs in that area. The incentives that we would like to introduce would be to provide a risk allowance to the police officers, so to motivate them to want to do this job, because it's a dangerous job and we all know that they put themselves at risk. The physical designs would be to increase lighting in that area and to maintain the buildings, because the buildings are run down in that area, and that allows it to be an environment where it's more prone for them to have access to drugs and trafficking of drugs in that area, and to increase signage also. So the policies would be, we would like to help to implement this policy in our country, would be to create monitoring and evaluation units within the police force, so that they will allow them to regulate the implementation of the programs and the trainings, and also to try and make sure that the police officers are actually doing their jobs, which we found that there's a gap, that it's not enough. There's not enough being done by the police officers in that area. So that will allow us to decrease the amount of drug dealers that are selling heroin to these young people, and then to have the police to be more engaged and be more motivated to take an action against it. And then at the same time, this will allow us to have less youths and minors being impacted by heroin use and heroin addiction in that community of Mofleri. Thank you.
Thank you. Wow.
All right, ladies and gentlemen, that was the first presentation that we have as an example of what we're doing in the past 5 days. We do have another group to do the exact same thing, and they come right here from the country that is hosting us, Kenya.
All protocols observed, my fellow youth, good afternoon. My name is Alvina Majiwa from SCAD, that is Student Campaign Against Drugs.
And I'm Moses Ochieng from Kenya Scouts Association.
In the youth forum, we were finding problems in our local communities and getting solutions, actionable solutions that we, the youth, can solve. In Kenya, we identified the Area 42, which is in Kibera. Kibera is one of the largest slums in Africa with an approximate of 1 million population. In Area 42 is one of the villages that is located in Kibera.
And to continue with that, I'd like to show you the hotspots for consumption of bang in Kibera. So our problem statement was sale and consumption of bang by young people in Area 42 aged between 17 to 25 years. So one of the major hotspots for bang sale and consumption is the residents, we have the public toilet, and the main hotspot being the car wash. I personally train in Roland National Scouts Camp, where scouting activities do take place. Other than that, we also have a social hall and a dump site. So we had two risk factors, one being the social access and the law enforcement. We majorly decided to talk about the social access, whereby we had the young people aged between 17 to 25 years are the ones who are consuming bang in the car wash and near the public regions in Area 42. So we came up with intervention plans, that is, we'll provide information and how. We'll use door-to-door campaigns whereby we'll educate on the risk and the penalties of the use of bang. We'll also supplement our operations by use of media, whereby we'll go to Pamoja FM to talk on the dangers and the dangers of using bang and their penalties. We'll also build skills through training on preventive and refusal measures, on avoidance of use of bang. We will also provide support through referrals of bang users, whereby we'll partner with ISSUP-4, one of the counseling centers in Kibra. We'll also try to find access where we can access the bang users, where we say finding the area that is close to the people, which was the car wash and our main hotspot. We'll also use incentives, whereby we'll give rewards and promotions, and also we'll have branded merchandise like t-shirts, wristbands, to those who will have completely, will complete the course successfully, and we also will change our physical designs by putting up street lights in the car wash region to discourage the use of bang, and we'll also put policies and regulations whereby we'll engage the police about bang awareness through dialogue in order to sensitize people that use of bang is illegal. Thank you.
In order for us to actualize this, we have an action plan, and this is how we're going to carry out the 7 steps. In providing information, we're going to use the media. We're going to meet as a group and research on the dangers and use of bang. We will open an email address where we will draft an email and state the program that we will send to Pamoja FM. In building skills, we'll contact the self-help group in charge of the social hall, where the bang prevention and refusal training will take place. In providing support, we will email ISSUP-4, informing them the need of us and them partnering in order to educate the youth on preventive measures and counseling them on why not use bang. In access, we're going to create posters that have the preventive measures information on bang and place them in the car wash, which is the area that is mostly affected by bang users. In using of incentives, we're going to create merchandise designs that are branded with the message against bang use. We're going to print them. Those are t-shirts, lassos, and wristbands. In physical design, we're going to change our physical design by approaching the MCA's office, that's Mr. Lawi, inform him about putting up lights in the car wash area. We're going to change the policies and rules by using the following ways. We're going to approach the Kilimani officer in charge, inform them on the need to create awareness through dialogue to sensitize people that bang is illegal in Kenya.
Yes, thank you. We all come from Kibera 42, and we'd like to take this opportunity to ask NACADA, UNODC, and KALKA to help us work together to change Kibera and make it a better place for everyone. Thank you.
Ladies and gentlemen, it is my belief that both the Kenyan group as well as the Seychelles group deserves a warm round of applause, ladies and gentlemen, for the work that they have done. It would be a great dishonor if we're not to say thank you to the team that actually came together to ensure that we got the training, that we were able to actually develop these implementation programs. We had an amazing group of trainers as well as trainer assistants who have worked incredibly hard to ensure that they could give their knowledge as well as experience and pass it on to the youth that are standing before you. But in the same light, we have to say thank you to the youth that took out time to ensure that they gave everything that they had in order to be able to actually draft up these implementation plans. We have 30 plans from this group before you, and it is our sincere hope that those 30 plans will be implemented in this African continent in order to have a great change in the substance and alcohol abuse. All right, so what we're going to do right now is we're going to read what we call a UNODC youth statement. This is basically what we have come up as a group in order to basically give our voice behind the epidemic that is substance abuse. And ultimately we're going to do that together as a group with my lead. With no further ado, ladies and gentlemen, represented here are 19 African countries, leading 180 young leaders from Africa and lending the voice of 2,030 million young people across the African continent. We stand before you to speak to the issues of substance use and demand reduction in our communities, aware that we were a once colonized continent that has won the battle, and equally aware that we now stand at the doorway of generational issues that have created breeding grounds for addiction and substance abuse. It is no longer acceptable to deem substance abuse another economical issue faced by the continent, but it is now time to actively raise our voices and demand action from both you and ourselves. In our communities, the ramifications of substance use are evident. Abled men and women, children with great potential and great leaders are losing their lives to substance use. Communities have low quality of life because of substance use members not being able to participate in social, economic, and political development. This impedes on the realization of the Sustainable Development Goals and Africa's 2063 agenda. Ladies and gentlemen, it is unacceptable to regard substance use as a minute issue on the continent. There has never been a better time to take on the global scourge of substance use and its impact on our communities. The time is ripe to actively raise our voices and work towards implementing these said solutions. We know the impact of substance abuse, but you might ask the question, what do we do? First, we ask you, our adult leaders, to sanction establishments of continental and national authorities where data on substance use is regularly updated and readily available. The research process lays a foundation for effective decision-making within the context of evidence-based interventions leading to population-wide impact. Secondly, we challenge countries through the framework of the intergovernmental organizations such as the African Union and the UNODC to ensure 70% of all resources levied on legal substances are reserved for harm and demand reduction initiatives with no caveat at all. We challenge the business community and religious institutions to set aside resources for community initiatives that improve the health and the well-being of the constituents. We recommend the propulsion and championing of community-led initiatives to reduce substance use, harm, and demand. These have the potential to transform our communities into healthy, productive entities that thrive. They are result-oriented, community-led, and data-driven. Finally, we have listened to the rhetoric preached to the youth that we are the leaders of tomorrow. That tomorrow is never promised. We instead are letting you know by our words and our actions that we are the leaders of today.
All right.
Effective immediately, we are stepping up and taking our rightful place in substance use and harm reduction. The challenge is on you to catalyze and empower youth leadership for effective interventions across the African continent. Over the past 5 days, during the second Global Youth Forum on Drug Use Prevention, we have learned, unlearned, and relearned about community-led interventions, designing 30 community-focused interventions in the process. We are now amply knowledgeable and skilled to implement these said interventions in our communities. It is our sincere hope that you support and collaborate with us. We therefore ask that you consider our proposal to reduce substance use, harm, and demand in Africa. Now, all the youth together. A drive and a hunger for change as a group of young Africans. We say that we are willing to be the agents of change in our communities. Trust and enable us to implement change and watch change happen. We are the key to unlocking effective prevention against drug and substance abuse. We thank you.
All right.
On behalf of the host country, represented guests, different organizations that have made this possible, I want again to thank you on behalf of the Youth Forum. Thank you so much, and God bless you. It was our time. Thank you.